All right, good morning, everyone. Welcome to our briefing this morning. Today, as we get started, we're going to expect to see our case counts increase today at probably a pretty significant level, and we're going to see that for the next several days, I would anticipate, with the 4,000-ish tests that have been run at the community specimen collection site. We're going to see a lot of new positives in our market. So it's important to know that right out of the gate, that we expect that, we anticipate that, so when those numbers come out, we're not going to be caught flat-footed because we know that's going to happen. What we are starting to look at more closely is our percentage of positive case rate. So simply looking at the number of new cases or even the number of deaths, while those are tragic numbers, those are tough numbers, they aren't a good indicator of what's happening with the virus. So in the Sioux Falls MSA, Minnehaha, Lincoln, McCook, and Turner, this is a number that we're watching pretty closely, is what is our percentage of positive cases? So if we test 100 and we only have 20 cases come back, we had a 20% positive rate. That's a number we want to keep seeing go down. So for you as the media and others, when you talk about wanting to report on good information and good data, that's a data point that I think is very important to keep looking at. We also are obviously watching hospitalizations. We'll take a look at that here in a second because that's also a very indicative, somewhat of a trailing indicator, but it also tells us what the virus is doing in our market. At yesterday's special council meeting, we passed an ordinance 47-20, which we're going to be calling no mingling ordinance, just to give it a name so we all are talking about the same thing. This ordinance will ease some of the regulations that were put into place in March to help slow the spread and control the spread of COVID. So just to really quickly clarify what is included under that, all of our licensed food entities, like restaurants, coffee shops, bars, they must separate all parties by at least 6 feet or a maximum of 10 patrons, whatever is greater. For almost all of those facilities, it will be the former, but for a couple that are very small and they can't put people 6 feet apart, it will be a maximum of 10 patrons. They must also limit the size of any single group of patrons to 6 or fewer adults. So children 18 and under not included in that. So a real specific example, if there's 6 adults and 3 kids under the age of 18, you can have 9 people in that party. They can go to a restaurant. They can be seated as a group of 9. The next closest group would have to be 6 feet away from them. So our recreational facilities, athletic facilities, health clubs, entertainment venues, movie theaters, that sort of thing, they're going to be limited to 50% of the maximum occupancy of that business. And as of today, as of publishing today, these are in effect. All businesses, however, within city limits are expected to continue to maintain social distancing between their parties, whether you're affected by this ordinance or not. We anticipate there'll be questions by businesses. I had a business reach out to me yesterday. One had a lot of questions, and I just put them in touch with our SOAR team and said, hey, we'll come out, we'll check out your business, and we'll help you to be successful with this new ordinance. And so COVID-19 questions at siouxfalls.org is a good email address to use to reach that team, or call 211. It's very important to remember that while we have loosened some of these regulations of the city, we still have a lot of work to do to protect public health. And that response continues to be the primary goal of what's happening in the EOC, is protecting our public health. We're working regularly with our healthcare partners to analyze numerous data points, one of which I'm sharing here, to make informed decisions as a community. So the chart that you've seen before, I want to read, this is the most updated data. It's a little bit small, putting all those on one slide, but again, this is the most recent data that really looks at the populations and the age demographics that are most affected by COVID in our MSA. And so when you look at Sioux Falls, again, The largest demographic age group we have in this city is people 0 to 19. However, if you go down here, kitty corner, see the percentage of cases that have resulted in death, and this is statewide, most of the fatalities from COVID are occurring in people 70 and over, okay? So it's also important then to realize that the majority of the carriers of COVID, the people who have tested positive, are not in that demographic, right, or in the younger demographic. So what is this really telling us? It's telling us that anyone can be a carrier, okay, and it skews actually younger. A lot of the tests that we've had, we've seen carriers being younger people, but the people that really have to take this seriously from a healthcare standpoint are our senior population. They're also the highest percentages of those that are hospitalized. So this is why wearing masks, things like that, is important. Because while if you're 29 years old, you may have a very low chance. In fact, we've had no deaths. You may feel invincible because you're 29, 28, and no one's dying in that demographic yet in South Dakota. But by you easily spreading that, you could very, very well be a carrier. You could very easily be spreading that to someone who is in that demographic. So that's the point of all this when we talk about social distancing. Why do you wear a mask? Because I'm 42, okay? Very low death rate. But if I go into a store and the clerk working there is 65 years old, I'm doing that to protect that person in case I am asymptomatic and carrying this, and I want to protect that person that is helping me and assisting me. We also have been tracking this. As you know, this is our active hospitalization rate. And with the amount of community testing that we've been doing to the specimen collection site at Smithfield and the community testing we've been doing there, we saw an increase in the active case rate yesterday. This is not a concern yet for us. We expect this to continue to increase. So that's anticipated. That's anticipated in our numbers. Our healthcare organizations anticipate that. But that will, if that goes up and our hospitalization rate starts to increase at an exponential rate as well, that would start to be a concern and a problem point. So the key word right now that I'm telling a lot of people and even telling our team is flexibility. We are in a time of flexibility where we have to be flexible and responsive to what we're seeing with numbers and what we're seeing with data. I'll show that at the end here. So the governor has an executive order out for our vulnerable population that is set to expire on May 11. She may or may not renew that based on some of this data we've seen. Whatever that decision is to renew that, it's just very important that those vulnerable populations continue to take this very, very seriously right now. Like many businesses in the community, the city of Sioux Falls is also having to make steps to quote-unquote reopen. And what does that look like for us? This morning, I want to announce that City Hall and City Center will begin reopening as well in a limited capacity starting on Monday, May 18th. And so at City Hall, our service counter on the ground floor will reopen for our utility billing, and public parking services. So that will be reopened. Our human resources, human relations, our city attorney office, GIS, finance, those will be open by appointment. So you can make an appointment if you need to see any of those folks, and you'll be able to see them. The mayor's office was never closed, so just want to make sure that that's out there. You can always come and see the mayor's office if you have an appointment or need to drop anything off there. You can always come to my office. That has never been closed. Over at City Center, our new City Center building, that will be reopening on Monday the 18th to assist people with planning and permit applications. A lot of that's been able to be done online so far, but that will be reopened. And we'll be implementing some new procedures in there in terms of some social distancing practices of how people will get around in that building. The other big question people are having is on sports events, pools, athletic fields, athletic leagues. We had a call this week with a lot of the league organizers of baseball, softball, soccer leagues, tennis leagues, to better understand what their challenges are and also let them know what our challenges are as a city. And we told these representatives that we'll make a decision regarding organized athletics in the city on May 29. And a couple reasons why we chose the 29th. One is that's about 3 weeks. It is 3 weeks from today. It'll give enough time for this ordinance change to breathe a little bit, to see what we maybe see in the community in terms of data. It's also soon enough, though, that they can have a good semblance of a season if we're able to make a decision by then. So we're asking all those leagues to submit a plan to us. How will your league operate? How can SEBA operate effectively in this environment and make sure the kids are safe, spectators are safe, the umps are safe, all the volunteers, what do concessions look like, parking. So they're expected to submit that to us. And, the city is not immune to staffing challenges and financial challenges. We have not hired any seasonal staff for our Parks and Rec team. Our Parks and Rec seasonal staff, we hire hundreds of people in the summer to mow lawns, to drag fields, chalk lines, to take care of all those diamonds, to lifeguard at our pools. We don't have those people on staff because of COVID. So the city's not immune to this. So that's what we're asking those leagues to figure out is how can you operate successfully with the limited resources that we have to provide the services you need right now. And so more to come on that as we get closer to the 29th. Last couple things. It's National Nurses Week. It's very timely that it's National Nurses Week. Please thank a nurse. Thank the great work the nurses are doing. A lot of times we hear from docs and we hear from MDs, but the nurses are on the front lines. So please thank nurses and the work that they do. Your own Jill Franken, our Director of Public Health, is a recovering nurse herself, so thank her. And then obviously thank all our moms. On Mother's Day, I'll give a shout out to my mom. I love you. Tell your mom you love her. Send her a text, send her an email, or more importantly, call her and tell her that. And then we continue to just encourage people to get out and exercise. We awarded a couple more prizes to some people who are getting out as part of our 100-mile challenge in 100 days. It's been very fun to see the hundreds and hundreds of people that are participating in this. So with that, I will open it up for any questions that you guys may have for me. Jill is also here as well.
What about bus routes? When might those become more available?
Question was about bus routes and when will our bus routes maybe re-expand to what they were normally. We had a council meeting this week in which the council chose to continue to extend the limited transit services we're offering, but the council made a decision they only wanted to extend that for a week and they wanted to review it in a week. So we'll be talking about that on Tuesday night at our council meeting. The demand is not there. Not only is the demand not there, our drivers have been impacted by COVID. We have several that are quarantined, several that are positive, several that fit within the governor's executive order. So we have a shortage of drivers as well. So we'll be watching that closely. We'll see what this ordinance does. If this ordinance really picks up the demand for people to use transit as well. I mean, we don't take pride in limiting transit right now. I'd love to have transit running as long as we can support it and have the drivers to support it. So Tuesday night we'll be looking at that again.
What about places like the zoo and the butterfly house? How are you guys working to kind of get those reopened as well?
Question was about zoo, butterfly house, places like that have independent operations. They're creating their own plans for opening. They're working with our parks team. Specifically, the zoo is on that. Much like the pavilion is creating their reopening plan. I anticipate that the zoo will be opening fairly soon on that specific example, but with a new experience. The indoor area of the zoo probably won't be open. It'll be a different experience, but a similar experience still. You go to the zoo to see animals outside. Let's be honest, that's what people want to do. And so I don't think, at least I haven't seen the zoo's reopening plan yet, but I expect to see that very shortly, and I think they'll be open soon.
Can you give us an update on how the city might be working with long-term care facilities to help kind of calm or mitigate the spread of the virus within those facilities?
You know, the question was, how is the city working with long-term care facilities and the spread in those facilities? You know, that really falls under the jurisdiction and the purview of the State Department of Health. And so that would be a question for the governor and for Secretary Malzen-Reisen on that. Any other questions this morning?
With that little spike, does that make you a little bit more cautious as far as now beginning to reopen? But I mean, that's a pretty good jump there that we just encountered in the past 2 days.
Yeah, I mean, it is, but it's anticipated. We expect that. So it really doesn't make me nervous at all. And I don't mean to say that with bravado, but we're going to see that. And we're anticipating that. So our planning takes into account that those cases are going to grow. And so I heard someone describe it this morning on some talking head news show that we have entered the trial and error phase now in our country, where all these states and cities are trying different things, and that we're having to watch the response and watch information closely to determine, do we turn transit back on or not? Do we open the zoo? Do we allow parks leagues? Do we have to only allow some leagues in our parks to operate? Do we open pools? Do we not open pools? So there's all these dials that we have to just keep playing with in the community, but we do anticipate there will be growth in cases. There will be deaths in our community from COVID, and I've said that all along, and that's not to minimize the tragedy of losing a life to COVID. But there are going to be fatalities from this, as we've seen already. We are focused on what can we do to minimize that and ensure that if those people do contract it, that we have the healthcare facilities to do everything we can to ensure that that person has every shot to not pass from this virus.
So the preparations up to this point, there's definite confidence from the administration that you're ready.
Very much so, confidence, yeah.
I was gonna say, are you gonna be enjoying restaurants or shopping places this weekend with your family, or what are your plans?
Well, it's a good question. The question was, will I be going out to restaurants and shop places? Personally, I will not. You know, and that's what we're doing with this. This is what I call permissive legislation. So it's legislation that permits it, but each person has to make their own decision. For myself and my family, and this is not, I'm not speaking as the mayor, I'm speaking as a dad of 3. No, we're not going to do that. So, all right, thank you guys. Have a good day and a good weekend.